Board of Chiropractic Examiners Licensing Committee is being held by teleconference pursuant to the statutory provisions of Government Code Section 11133. The date is Monday, October 3rd, 2022, and the time is 12 o'clock. The board's paramount responsibility is to protect the health, welfare, and safety of the public licensure through public licensure, education, and enforcement in chiropractic care. Members of the public may address the committee during the public comment session. Public comments will be taken on agenda items at the time the item is heard and prior to the committee taking any action on said items. Those who would like to provide public comment will be limited to 3 minutes, unless in the discretion of the committee, circumstances require a longer period. Members of the public will not be permitted to yield their allotted time to other members of the public to make comments. Individuals may appear before the committee to discuss items not on today's agenda. However, the committee may not discuss or take action on these items except to decide whether to place the matter on the agenda of a future meeting. Please be aware that this meeting is being recorded, and please turn off or silence all your cell phones. We will now take roll. Ms. Cruz, will you call the roll?
Pamela Daniels.
Present.
Jeanette Cruz. Present. We have a quorum.
Okay, great. So we'll begin with an update on the board's licensing program. Ms. Walker, can you provide us with an update on the board's licensing program?
Sure, yes, thank you. So throughout the summer and into this fall, staff has been working quite a bit on updates to the board's Connect system, particularly as they relate to licensing. On July 1st of this year, we added functionality to the system to waive the application and initial license fees for spouses of active duty members of the military who are assigned to a duty station in California and hold a current license in another state, as required by Business and Professions Code Section 115.5. Followed by that, in August of 2022, we implemented the Department of Healthcare Access and Information Healthcare Workforce Data Survey for licensees to complete during their online renewal process, as required by Business and Professions Code Section 502. Currently, what we're focusing on is system enhancements to increase the system utilization rate by licensees, and specifically what we're working on is simplifying the renewal process for the primary DC license type by removing the table that currently requires licensees to enter all of their CE information on the application. In addition, we're focusing on making the dashboard itself easier and more intuitive for users to navigate through the system by separating the content into multiple tabs. We're also providing the ability for licensees to store their CE records in the system on the dashboard, and those records will be immediately available to the board upon an audit to eliminate the back and forth of the paper process that we currently have. We're also working to prominently display a list of all of BCE's resources and links to common questions and just items of interest directly on the dashboard, as well as provide licensees with the direct contact information for each of the board's programs prominently displayed when they log into their account. Each of these enhancements is currently projected to be released this fall, and then from there we're going to be focusing on the development of the CE provider and course approval process in the system. Are there any questions from the committee on the Connect project?
Ms. Walker, when, so I know you said fall, so when are we expecting like the first group of people to be able to do their relicensing online?
So it's live right now, but where we're encountering a low system utilization rate is the way the system is currently designed to renew the DC license. Not only do you have to answer the questions about conviction and disciplinary action, but you actually have to go in and upload each and every certificate for your 24 hours of CE that you completed within the renewal period. And we think that that's largely contributing to the low system utilization rate because we're still seeing quite a bit of checks in the mail and paper applications. And the benefit of the system is the fact that after you file the renewal online, it automatically is processed in the system and your license status updates within 48 hours compared to the weeks-long time frame for processing it through the mail. So what we're looking is to really drive the traffic to the system by, instead of Instead of having the existing table, we're pulling that off and just replacing it with a question just to mirror the paper application process where you certify that you've done the CE and you make the payment, and then the license will automatically update. And then on the back end, we'll go through the audit process just as we would with a paper application. As far as those, some of the updates, we're currently in what's called a regression testing period right now. So some of them have already been built. We're just testing to make sure that the functionality works as expected. And then we're projecting to release it within the next few weeks. And then some of the larger refinements on the user dashboard, we're looking at probably early November or so. It's a little bit later into the fall, but we have some stuff teed up, almost ready to release. We're just verifying that it works as expected before we roll it out. And particularly that's the streamlined renewal process.
And so do we feel like all the licensees know that this is available and ready to go?
They don't yet at this point. So from a strategic standpoint, what we're planning to do is we are kind of making it more intuitive and easy to use, and then we're going to get the word out at that point. What we're having is right now, the system itself, once you log in, it's not necessarily plainly obvious where you need to go and which links you need to click to interact with the system. So once we get it to where it's an easy process to use and it's quick and efficient, then we're going to be working very closely with the department to help get the word out, not only through our website, but all of our communication channels to really try to drive traffic to use the system.
Okay. Yeah, I feel not everyone's going to be going to not all licensees will always be going to the website. So using the other communication channels, I think, is key to notifying people that it's ready to go.
I agree. And we also will be working with the department for the paper renewal notice that goes to each licensee, including some kind of flyer or insert or some kind of notification right there. So it's plainly obvious that you can go online and take care of your transaction that way with the 48-hour turnaround time.
Okay. Ms. Cruz, did you have any questions?
No questions for me.
So another item of note as it goes with the licensing program is our sunset bill. Senate Bill 1434 was just signed by the governor on September 27th, and it will become effective January 1st of 2023. As it relates to the licensing program, this bill is going to be implementing an updated fee schedule for applications as well as our licensing functions. And it's also going to have a requirement that licensees file their telephone numbers and their email addresses with the board. So we're going to be working with the department to make the necessary updates to our renewal processes so that we can try to capture the phone numbers and email addresses of our licensee population kind of as easily as possible. And then the benefit of the Connect system is it allows licensees to go on that system and update their address, their email address, and their telephone numbers with the board in real time. So we're trying to make that requirement as easy for the licensees to comply with. And then we're going to be monitoring kind of throughout 2023 to just ensure that we're collecting it for all of our active licensees. And then we'll have to have some kind of targeted outreach if there's certain licensees that haven't filed that information with the board in compliance with the new updates to the law.
And
then can you just, yeah, go ahead.
I was going to ask, is that information currently, at least the emails and phone numbers, is it currently captured currently as like an optional field, or is it just this is all brand new information that's been captured?
So so we have two systems. So the Connect system captures both because when licensees sign up for their account, they give us a phone number and we have the email address, which is their username to get in the system. And that's likely eventually, as everyone creates accounts, most of that data is going to be housed there. Our legacy licensing system, CAS, currently only captures telephone numbers, and it's not a complete listing of records because if a licensee provides us with the phone number, we'll enter it in the system. But there's some records that have no phone number, and in many cases, what we find is when there's an issue with a licensee's application, we try to call the phone number that's actually on record for us, and it turns out it's not a current number. So through this kind of effort, we're going to be trying to reach all licensees to make sure we get current up-to-date information so that we then can we have those channels available. And it's really going to benefit us in the long run on the staff perspective because it's going to provide us with quick and efficient communication with licensees. If there's a minor issue with, say, an application or something that was submitted, we don't have to send them a letter. We can just give them a call. We can follow up with an email and hopefully resolve it within hours instead of weeks.
Yeah, thank you.
And then, Ms. Walker, are you gonna, can you just talk again a little bit about these, with the bill, the Roth bill that you're talking about, the specified exemptions from probation?
Yeah, so on the enforcement side, so about the last meeting of last year was when the board discussed issues with there's the existing patient notification requirement that requires licensees placed on probation to notify patients of their probationary status. But then within that law, there are certain exemptions, and it's a longer list. And most problematic to the board was the fact that it was circumstances where the licensee wasn't immediately known to the patient until immediately at the start of the visit, or for unscheduled visits. So within our sunset review report, we included the proposal to remove those exemptions, thereby eliminating kind of loopholes that we were finding where licensees placed on probation could avoid notifying patients of that status. And most concerning to us is those are the situations where if a patient goes in the office and they're not sure who they're going to be seeing, they don't have the benefit of being able to go on the DCA license search system and check into someone's background because they don't know who they're seeing until they see them. So it's even more imperative in those circumstances that they be given the written notification requirement. So Senator Roth and the legislature agreed. They put that in the bill, and that new updated requirement with a shorter list of exemptions will become effective January 1st.
Okay, great.
As far as just other items I want to touch on with the licensing program, so what we've been really working on is taking a look at a lot of our manual paper-based processes within licensing, especially on more of our miscellaneous application types. We've really been doing a comprehensive review of those processes, trying to identify and remove any duplicative or unnecessary steps to improve our timeframes, and also prepare for the eventual integration of the rest of these processes into our Connect system. And also through those efforts, a lot of our staff have been cross-trained in licensing functions, which allows us to better serve our applicants, licensees, and the public.
Do you see any challenges or problems with implementing this?
No, because it's kind of we're in a good place strategically to kind of roll this out. Because with the Connect system, the initial thought behind it was we were going to build out HTML applications for each of our applications types. Instead, what we're looking at doing is creating. So we have those built out for our most common applications, but then with the rest, more providing a portal where someone can complete just a straightforward, easy to use PDF, upload it in the system, pay the fee, and submit it to us. And then we're working on the back end on what that process looks like to just to process it within the Connect system and not and eliminate a lot of the paper that we have floating around the office. So it's beneficial in a lot of ways, and it's giving us the opportunity to really update our procedures in the licensing unit.
This may not be relevant. I noticed in the licensing population by type how it's categorized. Do we have inactive licensees in this section or represented?
They're not broken out separately in that data. We can certainly report back at the next update with more in-depth data breaking it down by application status type. It may even be helpful for the committee to take a look at active and inactive licenses, and then also look at the population that's in forfeiture and canceled status, because it kind of gives you the view of what's coming on the horizon, how far out of date some of our licenses are.
Yeah, I think that would be really helpful.
Okay, we'll bring that back for the next update.
Okay, great. And did you have anything else on the update on the licensing program, or should we move on?
That concludes my update unless there's any additional questions by the committee.
Ms. Cruz?
No, I was only going to peer if there was any kind of roadblocks hit in there in terms of what specific timeframes they've seen improved or that you're focused on, but it's okay.
Okay. And can we move on to the next item?
We should probably open this for public comment in case anyone on the line has a comment on it as well.
Yeah, I wasn't sure. Moderator, can you open this up for public comment?
We are opening up for public comment. If you would like to make a comment, please type the word comment into the Q&A box in the lower right-hand corner of the screen and send that comment to all participants. Dial-in users, please dial *3 to raise your hand, and we will call on people in the order we have requests. We're going to take just a few seconds now to see if we have a request for public comment. And we have a request from call-in user 2. Hold on just a moment. We're sending you a request to unmute your microphone. Please dial *. There you are.
Hi. I know the note was the public comment. I don't know if this is a public comment regarding what was just spoken about, but this is a separate public comment, so I don't know if this is the correct section to present myself yet.
Public comments are on the updates, but I'm not quite clear on what you said. Will you try again?
Is this a comment on what was just addressed, or is this the official section for public comment, for any public comment?
This is for. Go ahead, please.
No, go ahead.
This is a public comment section for the update that we just heard.
I'll wait for the separate. I don't have any comment for what was addressed.
At the end of the meeting, we have public comments for items not on the agenda, and we have suggestions for future agenda items.
Thank you, pardon.
Additionally, after each section or item that's on the agenda, we'll open up again for public comment. So if your question pertains to one of those, you'll have an opportunity then as well.
There are no additional requests for public comment. Do you wish to return to the agenda?
Yes, please. Okay, so are we, Ms. Walker, are we ready to, okay, great. So the next agenda item is to review and discuss possible recommendations regarding the submission of the comments regarding the revisions to the Council on Chiropractic Education Accreditation standards and also the CCE Residency program. Ms. Walker, can you provide the staff report on this agenda item?
Sure, yes, thank you. So just a little bit of background information on how this came to be. So the Council on Chiropractic Education, the CCE, is the accrediting body for the Doctor of Chiropractic DCP programs in the United States. The board was notified on September 1st that CCE is conducting a 60-day public comment period through October 31st regarding proposed revisions to the CCE accreditation standards and the CCE residency accreditation standards. Staff reviewed the proposed changes to this language. For the most part, they're quite numerous in nature, but there's quite a bit of clarifying language and changes in wording within the standards. There's the theme of focusing on the DCP program rather than the institution as a whole. But as far as reviewing that, there weren't too many concerns on the staff perspective other than where they were talking about the examples of evidence being moved to a guidance document. That raises some concerns and red flags on staff, just because generally what that ends up doing is instead of outlining it directly in the accreditation standards, when it becomes a guidance document, it becomes a lot more optional. So just from the consumer protection standpoint, we have some minor concerns about that. Not that we don't believe it'll be still be enforced, but it's kind of taking the perspective of it being right there in that same document. And once it becomes guidance, how much is that going to be applied when they're reviewing those standards? We also wanted to note that the addition of the diversity, equity, and inclusion for faculty and the addition of the meta competency of cultural competency is really beneficial to California, and it clearly reflects the values of this state. There are quite a few changes that are in there. I'd be curious from the committee members if there's anything specific that you wanted to discuss, or if you had specific questions. But from the staff perspective, we don't have too many concerns other than just with the examples of evidence being moved to a different document.
Okay, thank you. I do have some comments, but Ms. Cruz, do you have any discussion items?
Not yet, going through my notes, but go ahead.
Okay. So, Ms. Walker, I was concerned about the same thing as far as the guidance document, and was wondering if all the line items that were taken out, if those are going to, there's several pages of them, if they're going to be, what exactly is going to be moved into the guidance document, and how is that guidance document going to be provided? My concern, again, I think they're taking a programmatic approach versus an institutional approach, which is kind of the summary of what they're moving for, clarifying some language, as you said. And so they're sort of trying not to micromanage, which I think is helpful, letting the programs for chiropractic evolve. However, I had the same concerns. And so that was one concern, is getting more information on the guidance document. And we can discuss this with Ms. Cruz and the public as well, as far as making a decision on that. I did have some concerns on the meta competencies, specifically starting on page 25 of the document. I felt the curricular objective, how their position is not to create a standard in chiropractic, however, to guide it. And on number C of page 25 in the curricular objective, it's, the language is very vague. It's case appropriate examinations that include evaluations of body and regions. Again, there's no comment on specifically saying, blood pressure, pulse, vitals, that sort of thing. This has been an issue that has come up in several board meetings. So while I get that they're trying to be generalized and vague, I do have some questions about that. Also, the outcome measures perform a case appropriate history that evaluates the patient's health status. Again, the language is very vague. And moving through the meta competency 2 and the management plan, and then specifically the meta competency 7, the chiropractic adjustment and manipulation, I feel like the language is quite vague, and it needs to be, my suggestion is more clear as to the risks and the complications, and also emergency procedures that would be indicated immediately if something was to happen, and the demonstration and knowledge of red flags. So I don't know if we can make a comment on that, but again, I feel like the language in those particular areas seem to be quite vague. So those are my largely my concerns with the document, was the guidance document, and then the vagueness of the language. And I know there was no proposed changes to the chiropractic adjustment and manipulation section. They're recommending just leaving it as is. And I had no concerns really with the residency portion of it. I thought it was comprehensive.
Thank you. Yeah, I agree with a lot of, so that's really the question there is on that guidance document, because it's not currently, I wasn't able to locate it. It seems that the messaging within the proposed changes is we're going to move it to a guidance document, but that guidance document is not also included so that you have both pieces. Certainly before the board meeting, I can reach out to CCE directly with some of the questions and concerns that we have. I think everything that you've brought up, they're all valid comments to make during a public comment period, even on with the adjustment and manipulation section. Although they're not making any changes in that area, they certainly had the opportunity. So I think if the board has concerns and there's additional information that could be added, it's certainly appropriate for us to submit that as a public comment.
Okay. Before opening it up for public comment, Ms. Cruz, do you have any comments?
Well, I was looking at what's it called? A combination of medical competency 3 and 4. So 3 being health promotion and disease prevention. What's it called? I'm just looking at like the change in language and kind of like trying to understand the intent behind the change in language. I see in that first one, right, the importance of primary, secondary, tertiary prevention, population, the new language versus saying appropriate hygiene in a clinical environment, right? So a lot of clarification on what exactly they're looking for. And then I look to the outcomes of that section and I don't see similar language, right? And it kind of to corresponding to that. It's definitely manage the health risk and public health issues, but we keep, apply appropriate hygiene practices. So I guess I'm trying to see where A through D, and then 1 through 3 kind of connect to each other. I see it, but I do see some gaps. And then maybe this is just more informational for me. Is the outcomes, do they share out with for the outcomes what they specifically measure on the outcomes or no?
I would have to check with CCE and report back to the committee, or actually to the board on that one. I see the structure there where they're outlining what the objective is, and then they're having the outcome there. I would assume, but I would like to confirm that they're actually measuring that outcome in some way within the documentation that's being submitted for the accreditation.
Because I know just when going through the DEI lens, I would definitely want to just be sensitive to like, well, how exactly are you ensuring that? What does that look like? It's especially because obviously with the amount of changes, I would say that was done to the document based on that lens. Let me see, in competency 3. I think it was really just that of how exactly are they measuring that or looking at that, because it's saying, communicate effectively with diverse populations, or even in medical competency 3 under objective B, or not objective B. I think it was A. I forget which one it is. But it's really, I would say it's general high level language where I can see where there could be measures, but I can also see where what's it called? It can be lost in generality.
Yeah, to sort of continue on to that thought there on page 14, again, they're including demonstrating periodic reviews, but there's no, at least in this document, there is no definition of what a periodic review is. So I think that's Ms. Cruz sort of consistent throughout the document as to the finer points, and this may not be the place where those finer points are represented. Ms. Walker, do we have the ability to reach out and get more clarification on that?
Yes, yeah. So for the committee's concerns brought up during today's meeting, I'll reach out to CCE and try to get some answers to some of the questions. And that when the board is reviewing it at the October 27th meeting, I can report back with not only the concerns of the committee, but then also some of the responses that we get from CCE.
Okay. I would like to open this one up for public comment. Is there any other comments before we do that? Moderator, can you open this agenda item up for public comment, please?
We are now taking public comment on agenda item 3. If you would like to make a comment, please type the word comment into the Q&A box in the lower right-hand corner of the screen and send that comment to all participants. Silent users, please dial *3 to raise your hand, and we will call on people in the order we have requests. We're going to take just a few seconds now to see if we have a request for public comment. Seeing no request for public comment, do you wish to return to the agenda?
Yes, please. Thank you. So far, kind of what I'm hearing is we have concerns about the guidance document. We have concerns about measuring specific outcomes in different sections. And then I have concerns about more specific or stronger or clearer language, specifically in the meta competencies 7, 4, and 2. Do I need to make a motion to submit these suggestions, or how should we move forward?
Sorry, go ahead, Kristen.
Nope, I will defer to our legal counsel. Go ahead, Sabina.
Hello, good morning, everybody.
Hey,
Or afternoon. Oh my goodness.
feels like morning.
I think so. I'm going to go with that.
Okay.
So no need for a motion here. I know the staff and everybody's been taking some great notes on your concerns. What they're going to do is, like she said, they're going to contact CCE and bring it back to the full board anyway. That way you'll have your responses and you'll be able to meet with the full board to make the actual motion to either submit some comments, and that way our comments are going to be a little bit more complete and thorough with if we have responses from CCE ahead of time.
Okay, great. So since there's no public comment and no other comments and no motions needed, are we ready to move on to the next agenda item? This item is to review, discuss, and make possible recommendations regarding the application for a new chiropractic college approval by Kaiser University. They call it Kaiser University College of Chiropractic Medicine. Ms. Walker, can you provide the staff report on this agenda item?
Sure, yes. So the Act and the board's regulations outline the requirements for approval of chiropractic colleges by the board. The board received an application for approval by Kaiser University College of Chiropractic Medicine, which offers a Doctor of Chiropractic degree program at its main campus in West Palm Beach, Florida, and it received its initial accreditation status from CCE in January of 2019. Within the application, so staff reviewed the application, compared it to our existing regulations. We did note, let me see if I could just navigate real quick to them. We did note a few deficiencies where they weren't meeting some of the more specific and prescriptive standards within the regulations, specifically concerning attendance. Their graduate catalog and course syllabi require 80% attendance for sitting for the final exams, whereas the board's regulations require presence at least 90% of the time, unless there's been some evidence of illness or other excusable reasons that can be submitted. In addition, as far as the other three concern curriculum, so within the information they provided to us, they acknowledge they don't have physiology labs or 660 hours of what they quoted as true electives, which causes a little bit of concern. As well as the curriculum, they don't offer clinical experience in psychological counseling, as their position it's not within the scope in Florida. And then probably of most interest to the board was the fact that they don't currently quantify the number of their patient treatments, including the 250 patient treatments, written interpretation of the X-ray views, or the hours of practical clinical experience. So general information about their program is posted on their website. And interestingly, they do have a disclosure to students about professional licensure, where they've indicated that based on their review of the standards in the United States, that they believe their program meets the accreditation or meets the requirements in all states except for California. So the reason for bringing it to the committee today is, in addition to those prescriptive requirements where we've already identified some deficiencies, staff did note that within the application itself, there's likely some areas that may be of particular interest or the committee may want some additional information on. So we would like to kind of get the committee's input and feedback on the application before we go back to the school to not only point out some of the deficiencies, but then we can also relay some of those other items that we may have questions on. So with that, I'd like to turn it back to the committee if there's any specific questions that you had within those application or within that application.
Okay, great. Thank you. Ms. Cruz?
This is where I'm going to lean on you with your experience and going through the schooling, but I will be here.
Okay. Yeah, so before seeing staff's recommendation, I had similar concerns, and the fourth item on there saying they do not currently quantify 250 patient treatments. While I don't necessarily think that it needs to be a treatment, as there's an item that will be brought up later. However, I'm a little uncomfortable without that clinical experience and without that X-ray reading. I found it to be extremely helpful, especially if you're going to be a primary care physician. You need to have understanding of interpreting X-rays for sure, and you need that practical clinical experience that I think we need. And again, it doesn't necessarily have to be a treatment involved with that visit, but that you're having that interaction with patients. It helps you to learn to communicate to patients. It helps you to understand different cultural activities, you get experience and exposure to different conditions. I know that the clinical experience was extremely rich with various diseases and that you just cannot get from a book or from being taught it. I have less concern about the psychological counseling. It really is not in our scope. However, having a little bit of background in that is helpful because you're dealing with the entire person. You're not just dealing with one aspect, and if the person is in pain, it has psychological consequences. So while I don't think that is the former is more concerning to me than that item, I do feel physiology labs and the other hours of true electives, if nutrition is included in that is detailed into the CCE accreditation document as far as fuller healthcare and understanding of the person in front of you, making recommendations for lifestyle, nutritional changes, diet, etc. And so if that is not in there, we're sort of falling into the medical camp as far as they have very limited hours on nutrition. And I don't think that that's wise. 80 to 90%, I'm less concerned with that as far as the attendance. I wouldn't want to see it less than 80%. But again, the two biggest ones for me are the bullet point number 2, which is the physiology labs and the other hours of true electives, and then also the clinical experience with the patient visits and the interpretation of X-rays. So if Ms. Walker or Ms. Cruz, do you have any comments on that before I open it for public comments?
I appreciate the feedback on that. It's very helpful, and it gives us a little bit more context when we're communicating some of those deficiencies back to the university. But I don't have anything further to add. Thank you.
Yeah. I will say thank you for also that comprehensive kind of overview, because actually coming from the patient perspective, because I do kind of actively receive chiropractic care, it is all of those things you said in terms of kind of from the X-ray to kind of the person walking in, and just kind of the experiencing the kind of care and the kind of, I would say, consideration that has to come in. So I appreciate that.
Yeah, and what's interesting, at least it was my experience where I went to school, is you get some weird things coming into the clinic because the services are free and it's educational, so you're really getting different community members coming in who really do have different health concerns, and so that practice to me, I don't see how you get to what the CCE is recommending without that clinical experience. Okay, so with that, moderator, could you please open this agenda item up for public comment?
We are now accepting public comment on this matter. If you would like to make a comment, please type the word comment into the Q&A box in the lower right-hand corner of the screen and send that comment to all participants. Dial-in users, please dial *3 to raise your hand, and we will call on people in the order we have requests. We're going to take just a few seconds now to see if we have a request for public comment. Seeing no request for public comment, do you wish to return to the agenda?
Yes, please. Thank you. Okay, so at this point, Ms. Knight, I assume based on your last comment that I do not need a motion. Staff, I think, has clarification on moving this item forward.
That's correct. I'm assuming they're going to use the discussion today to communicate back with the school and then bring back any clarifications or other information to the full board. Did I hopefully understand that correctly?
You did,
That's
yes, thank you.
Okay. Okay. Before we move on, any other comments or questions on this item? Okay, hearing none, let's move on to reviewing and discussing possible recommendations regarding the existing requirements for filing practice addresses with the board and displaying licenses or satellite certificates at places of practice. That's California Code of Regulations, Title 16, Sections 303 and 308. Ms. Campbell, can you provide the staff report on this agenda item?
Yes, I can. Thank you, Dr. Daniels. So the board referred this topic to the licensing committee to begin a discussion of whether changes are necessary to the existing regulations regarding a licensee's additional places of practice, otherwise known as satellite offices. So CCR Title 16, Sections 303 and 308 require each licensee to file their proper and current place of practice, address their principal office in each sub-office or satellite with the board and display them in a conspicuous place. However, a place of practice is not currently defined in the regulations, and they don't address the temporary practice settings such as sporting events, fairs, house calls, mobile clinics, or even consultations at other facilities. So and another point is that unless a licensee has an established chiropractic corporation, licensees are only required to file their practice address with the board and not not provide a name for the practice, which can make it challenging for the board and the public to access this information. And there is not a clear way through the board or through the Department of Consumer Affairs license search to see all licensees that practice chiropractic at a specific location. So if you were to go to, the address of the location, you can't see through the board or through DCA, the license search, how many chiropractors are actually able to practice there, or if that you kind of have to go backwards and know the chiropractor who will be there and if they are actually able to be practicing at that location. And so staff have compiled research on 5 other California healing arts programs, including acupuncture, dental, medical, osteopathic medical, and physical therapy, and those are in the material as well. So acupuncture is the most similar to our board, where they're required to file their address of record in each place of practice with the California Acupuncture Board, and they must obtain and display and post their WA license in each place of practice. While the wall license isn't required to be posted when a licensee performs acupuncture treatments outside of their place of practice, they must carry a pocket license during treatments outside those places. Additionally, they define a place of practice as where any, or means an acupuncture office where any active acupuncture is practiced and includes a place of practice in which the applicant holds a proprietary interest or they can participate in the management or control. And so with the dental board, dentists are required to register their places of practice with the dental board. And they also have the ability to have fictitious name permits, which is where where they're able to, if there's a group of them, they're able to sorry, they're able to put the name of their corporation. Currently, that's not something that they're able to with our board unless they are an actual established chiropractic corporation. And then we have the medical board and the osteopathic medical board, which requires licensees to have their proper and current mailing address, but it doesn't require them to have their places of practice registered. And then the physical therapy board requires licensees and applicants to file their public address of record, residential address, mailing address, and email address with their board. And with that, I'll turn it back over to the committee for discussion.
Great, thank you. Ms. Cruz, any comments?
Well, that last one there was definitely a lot of information they're asking from kind of what's it called, from folks. Currently, I guess where my mind's going right now is of the information we currently have. I'm just thinking of the technical, the technical process of one, gathering all that information, but also maintaining that information kind of in-house as well. And my initial thought in terms of in the comparison across the different boards, what's it called? I can see an opportunity for us to ask for, I would say, more than the minimum of at least what's on the table, and then keep and identify some as mandatory and keep some as optional. But I think where my mind starts to go is more operationally of what is, and maybe that this is kind of where Ms. Walker can give some input, is kind of what is the realistic ability with the new system to be able to maintain that information. And if we go down the path of asking for more information.
Yeah, so is it okay, Ms. Walker, if I jump in real quick? Okay, so I know that there's some frustration. I think there's a company called One Medical that's frustrated. They have many licensees and they go out to different events and you don't know where that licensee is going to be that particular day. Also, you know, the world has changed and I think we do need to be more flexible, but our biggest concern, or my biggest concern, is sort of protecting the public and making sure the public is comfortable and able to access who treated them. And Ms. Campbell, I think you described that it's very difficult to do that. You sort of have to be very motivated and sort of savvy to kind of figure it out. So I have a couple, questions. I mean, we currently have your main place and then we have a satellite, but what we're not addressing is the sports events, local tenants, vacation relief, going to people's houses, that sort of thing. So if I put myself in the position of I'm at a sporting event and I go off and a chiropractor is going to treat me, I don't think I would be comfortable saying, oh, can I see your license? And that may not be a comfort thing. It may just that you're not thinking about it. Then something happens and you're like, I have no idea who treated me. I don't, it was at this event. So there's no way to track that. And if our main concern is the public safety, I think that's an issue, but we also want to be flexible and have a system so that people can practice and they can move around and not be tied to one place, because that's, not realistic. I personally didn't find much help from, the information was great. That's not what I'm saying, but the other boards, I didn't really give me much guidance as to how to make it better, how to move forward. So I feel like we have to kind of come up with our own own ideas. And I'll just throw this out before, I was trying to think of how can a person at a sporting event or having a different doctor come in, how can that patient be comfortable in getting the information without, with ease, as far as who is treating them and if there's a complaint or something happens. So, not everybody has a cell phone, but one thing that came up with, is it possible to have a third category of a mobile license, which is attached to either a satellite address or attached to your primary address, and perhaps having that information with a QR code. So wherever you go, the QR code can be scanned by whoever, and obviously you can deal with people who don't have a phone. That way the person gets the information on their phone. The QR code is provided. There's no information, that is, the person doesn't have to pull their license out of their wallet. The patient doesn't have to ask for the information. So that was one idea. I don't really know if that's even feasible, but that would handle having it attached to a satellite or having it attached to a particular address, and making the patient more comfortable, and also they get that information as well. So I think the issue is we possibly need a change in regulation, one, to be flexible to companies and chiropractors so that they can move around. And two, we need to have a way that the people receiving that care can follow up without feeling uncomfortable or without difficulty. So with that, I think I'll turn it over to Ms. Walker for comments.
Sure, and I just want to reiterate that at this point, this is the first time we're discussing this item. There's a menu of options that we have in addressing it, and it ranges from everything of do absolutely nothing because there's nothing wrong with regulation, which I don't personally agree with that one. But then it ranges to building out all new programs. I agree with you, Dr. Daniels, that I don't think the solution is within each of what we've kind of pulled from the other boards. There's probably maybe some picking and choosing within each one. Ultimately, from the staff perspective, the biggest issue we see with the satellite certificates and the current regulations that we have is, as we've discussed, there's no way to adequately account for mobile practices, temporary fill-ins. That situation is completely not addressed in the regulation. A place of practice itself is not even concretely defined in the regulation. So we use the word place of practice, but we don't actually define what that means. So then it leaves chiropractors kind of in a gray area when they are practicing mobile chiropractic. How do you hang your license on the wall when you've just gone to a house call and you obviously aren't going to get a satellite certificate for your patient's home? So that's kind of where there's issues with the existing regulation. There's also the issue of, as Amanda had mentioned, within the DCA search system, since we're not capturing actually the practice names associated with these different addresses, there's no easy way to pull information up. I kind of put myself in the shoes of a consumer, and if I'm driving down the street and I see an office and I see the name of the office, it just would feel natural for me to be able to go on DCA search and actually look up that office and get records of the people that work there. It's another challenge we have with our enforcement program, because within enforcement, a lot of times we're trying to track down who works at a certain practice. And most of the ones that are, most of the practices, they tend to have a pretty good web presence, but that's where we're getting our information from rather than our own records, which is concerning. And then the other kind of piece of it is kind of the opportunity that was kind of described with people that have multiple practice locations, or if you have a system that has multiple locations and they haven't quite decided who's going to be at each location, they want to be able to move people around. Kind of to put it into context with the way that we currently are capturing practice addresses, if you had a facility, if you have 5 facilities and you have 5 different contractors or chiropractors, if you have 5 other chiropractors that are going to rotate between those 5 locations, potentially, if those aren't their address of records, we're actually looking at a total of 25 satellite certificates, so that each one of those licensees has their own satellite for each address. That can be burdensome on the licensee to have to maintain all those addresses. That's now 25 transactions that the board has to process. So that's where something similar to where maybe a facility permit or something exploring that route might be more appropriate, where the licensee that's actually in charge of a specific facility files for a permit with the board and identifies who their staff are, and they're all attached to that same permit, so that there's just one person. We know who's responsible. We would know with the records, like who's actually ultimately responsible for maintaining records within the practice if it's not a formal chiropractic corporation. So there's a range of opportunities for discussion, and I think that's what we're really just looking for from the committee, is some kind of direction on what seems appropriate and where that line is, so that we can bring back some feasible options for future discussion. And then on your comment about the mobile license with the QR code, so that's been something that at the department level has been just very just kind of more of a long-term goal, but they've approached the topic of potentially putting QR codes on licenses, given the fact that even in a brick and mortar facility, if you have your license posted on the wall, it might say it's valid through July of 2023, but if we just revoked you last week, that's no longer accurate information. So the idea of putting some kind of QR code or something on it so that it would pull up the DCA search profile and it would actually allow people in the waiting area to actually pull up the license status and actually see current, true, up-to-date information is another opportunity. So I think I'd like to hear a little bit more from the committee on certain options that you might be interested in staff bringing back solutions to. It sounds like some sort of maybe mobile license or mobile certificate attached to the primary license might be something worth exploring. There are a few programs within the department that do have those options. I'm also curious if the committee, how they feel about the actual satellite certificate itself, or would you be more interested in something like a location-based option, tying each licensee at that location back to that permit, or if we want to continue with the individual satellite certificates for each licensee?
You mentioned, is this related to the facility permit option that you kind of mentioned earlier, or is that separate?
It's kind of sort of there.
Yeah.
It's I think we would want to get in there and craft it ourselves to something that really works most appropriately for us, but it's closest to kind of the examples of facility permits that you see within the meeting materials.
Mhm.
So I mean, we don't, in the regulation, I hear that we don't really have a clear definition of place of practice. Is it something that we want to spend our time on defining that, or sort of leapfrogging forward and solving the issue as far as the mobile chiropractors working out of several facilities? Or do we sort of need to go back to baseline and suggest a regulation change with defining the place of practice? I guess that's my question to you, Ms. Walker.
I would recommend taking it in phases with a long-term goal in mind. Not that we in any way expect the committee to come up with that at this meeting, or even the board to come up with that right away. But looking at the next sunset review period, we've got about 4 years. I think trying to get to that long-term vision in those 4 years, but maybe shorter-term solutions. You could consider we define the place of practice. I'd be curious to know from the committee's perspective, when we define the place of practice, where does mobile chiropractic, volunteer, weekend fill-in, sports events, how does that fit? Would you consider that a place of practice or not? That's what I'd be curious of for us defining that within the regulation.
Yeah, I mean, I see a mobile certificate not necessarily tied to a brick and mortar spot, but we need, and maybe the language is different, but we need some way of getting in touch and finding the licensee if we have questions or there's been a complaint made, et cetera. And I think it's quite possible there, maybe chiropractors that don't even have a brick and mortar that have a license and move from place to place. So defining a place of practice, is that something that we take out in the sense of it's a license to practice versus attached to an actual brick and mortar?
We potentially could. I think that actually your response gave me some clarification on that, because you are differentiating between mobile versus the brick and mortar. Another thing that within some of the other boards, statutes and regulations is the requirement that they notify with the board when they have no place of practice. So I think a good starting point could be defining the place of practice, requiring that if you don't have one, that you notify the board so that we explicitly know that you actually don't have a brick and mortar, then your address of record potentially could be some other address. But then also from there, you can start exploring what to do in the intermediate with a mobile certificate. It kind of ties directly into the notification requirements for notifying patients that licensees are licensed by the board. That's a piece of the CPEI regulations that we're likely going to pull out and bring to this committee at a future meeting. It has to do with the regulations requiring different methods of making sure patients are aware that chiropractors are licensed by this board. And there's different ways to go about doing that, including posting a notice on the wall, like you see when you go to your dental office or most of your medical offices, you'll see those notices on the wall. Or it could be accomplished through written paperwork and handouts, which would kind of accomplish that in a more mobile setting. So we can kind of explore that and bring something back. I do like the idea of exploring something similar to some sort of mobile certificate. The reason being, when we get into disciplinary guidelines, we're going to want to be able to set restrictions on those types of practice settings. It doesn't necessarily have to be tied to a certificate, but if we don't define what mobile means, it's difficult for us to tell people they can't do it. And I would say in a lot of the cases that we see, these licensees that are on probation, it's not appropriate for them to be treating patients in their homes or to be, at an address that's not already on file with the board. So if we start by defining it, it'll give us the ability to then, on the enforcement side, when necessary, restrict that practice.
Okay, so it sounds so definitely defining mobile. I mean, I think we have several different categories. We have people that have a brick and mortar and they don't go anyplace, and that's their primary place. They display it. I love the idea of having a QR code on the license where people can really see the activity of it and if there's anything else there. And then we have the satellite, which is, they go to one or two, maybe 5 other places, but then we have people who are maybe a combination of that, but also mobile. So, I would like to see if someone has works, say, for One Medical, but they're going out to other places where it's not a brick and mortar, that they have that mobile certificate, and that is linked back to who they are working for. So that way, if a patient is at a sporting event, they can find out who is treating them. So it sounds like defining a place of practice, also defining what a mobile certificate would be, clearly having an active license without, revocation, without probation, et cetera, would be, I assume, would be in the definition.
Yeah, we could certainly define it that way. I would probably suggest, as far as the staff work that we're going to take back, not only defining a place of practice, but then also probably, in addition to mobile, we should probably define mobile or temporary practice settings. And then that way we can draw the line on kind of determining that point at which a satellite certificate is required at a practice location.
Okay. Yeah, I mean, having, multiple locations and moving chiropractors around, and it could be 5 different places. It's cumbersome for staff, but it's cumbersome for the licensee, and I think it's an unnecessary a challenge to deal with, especially now when things have changed a bit and people are more mobile and traveling around and not just having a brick and mortar. I think it also could potentially help the profession where we don't have the classic sort of go to PT school, get a job with a physical therapy. But if people had, say like one medical and you could work for somebody and move around, I think that would open up chiropractic services as well. Any other comments from the committee?
Not for me. I think it's more of
Ms.
an
Walker,
education for me on the different types of licenses. Yes.
yeah. Before opening it for public comment, do we have enough direction for staff as to how to move forward?
Yeah, it's pretty clear to us. So we're going to start with the baseline of just defining these different terms. We'll plan to bring that back to the licensing committee at the December meeting, and then we can continue the discussion from there.
Okay. I would like to open this up for public comment. Moderator, if you could assist with that.
We are now accepting public comment on agenda item 5. If you would like to make a comment, please type the word comment into the Q&A box in the lower right-hand corner of the screen and send that comment to all participants. Dial-in users, please dial *3 to raise your hand, and we will call on people in the order we have requests. We're going to take just a few seconds now to see if we have a request for public comment. Seeing no request for public comment, do you wish to return to the agenda?
Yes, please. Thank you. And Ms. Knight, I don't think I need to make a motion on moving this forward. Is that correct?
That's correct. Like Ms. Walker said, everybody has been taking copious notes and has a direction now, and they can continue their work and bring it back to the board or this committee.
Okay, great. Thank you. Okay, with that, I'd like to move on to the next agenda item, public comment for items not on the agenda. Ms. Campbell, can you summarize the written comments that have been received for this agenda item?
Yes, of course. A chiropractic college student named Falcon Lumont, who attends Life Chiropractic College West, is requesting the board consider an addendum to California Code Regulations Title 16, Section 331.12.2, Subdivision E2, which requires students to complete a minimum of 250 patient treatments or visits, including diagnostic procedures, chiropractic adjustive technique, and patient evaluation in order to graduate. All three elements are required to be counted as a single patient treatment. Mr. Lumont is requesting the board or committee would consider awarding students partial points if chiropractic adjustive technique was not performed. For example, if no subluxation was indicated during the patient exam while they were utilizing another technique such as NUCA protocol over the diversified technique. Thank you.
Great. Thank you. So I'd like to open this agenda item for public comment and like to inform members of the public that they may address the committee at this time. Advise that the identifying yourself is voluntary and their name will be recorded in the official minutes of the meeting if it is provided. And so I would like to have the moderator open this up for public comment.
We are open for public comment for items not on the agenda. If you would like to make a comment, please type the word comment into the Q&A box in the lower right-hand corner of the screen and send that comment to all participants. Dial-in users, please dial *3 to raise your hand, and we will call on people in the order we have requests. We're going to take just a few seconds now to see if we have a request for public comment. And our first request comes from calling user 2. Hold on, we're going to send you a request to unmute your microphone, and the command is *6 to unmute.
Thank you, everyone, for this space to speak and expand on the public comment that I submitted. My name is Falcon, and I am a student at Life Chiropractic College West. All of the items, or what was presented is exactly what I feel is needed. I'm an intern at the clinic, and with the procedure that I'm utilizing in the clinic, a patient who continues to return for their office visits has been found, for the most part, to not have a subluxation as dictated through the procedure that I utilize. That being said, I am not allowed to perform a subsequent adjustment on the patient. Because of that, I'm not awarded any points towards graduation as defined through the laws and regulations. It has been suggested that I change my protocol. However, that would be in direct contradiction to what my proctoring or my facilitating doctor has suggested for the patient. So with this clinical experience, it's not being recognized at all. And if no change is made to the laws and regulations, then I won't be able to graduate. And I'm not willing to go against what the doctor has suggested, so that I could graduate. But there's obvious consequences to that. So I humbly ask if this is an addendum or an edit that is considered, who's involved with, who needs to approve it, who needs to sign for it. Who should write the exact language for the addendum, and when should when should a draft for this addendum be ready for proper consideration? Thank you.
Thank you. We appreciate you bringing this to our attention. And while we cannot discuss the matter, we have received it, which this is a forum for. And if you wish to leave your contact information to the moderator and the board staff, they can reach out. So thank you again for being present and letting us know your view. Are there any other public comments?
This is the moderator. At the moment, there are no other requests for public comments. And it is my suggestion that you contact the board directly at the email provided at the bottom of the screen.
Great, thank you. And also, are there any public comments to unrelated items not on the agenda?
This is the moderator. There are no requests from the public for additional comments not on the agenda.
Great, thank you. At this time, I'd like to open future agenda items and open this up for discussion by the committee and also for public comment on any future agenda items. And I can start with that. I would like to propose a future agenda item discussion around inactive licensing fees and having a discussion of possibly surveying licensees and getting feedback from the licensees as far as giving them metrics on where we're at with active versus inactive, the cost, and get an idea if active licensees are in favor of sort of picking up for the inactive licensees and having a conversation of what that looks like. So I'd like to put that on the agenda for next time. I would also like to put on the agenda for next time reciprocity requirements. Currently, we have 5 years as required, but I'm not sure we have a solid reason for this. And we need more information and from other states and schools as well. Additionally, I'd like to put on the future agenda the discussion about what this gentleman brought up as far as regulation on perhaps wording and regulations on treatment versus visits. Ms. Walker, the topic of Medicare, that should be put on the agenda for the regular board meeting, not this meeting, correct?
Correct, yeah. And we've noted the other 3 items you've mentioned.
Great, thanks. Ms. Cruz, do you have any future agenda items?
I wasn't sure. I was going back to my notes of what we were talking about earlier when you were saying active versus inactive. I wasn't sure if you wanted to add the forfeiture status, but that might be assumed already.
Not assumed, but I would take Ms. Walker's lead on that. Should we include that as well?
That's up to you, Dr. Daniels. So as far as the statistics that we're going to bring back within the license program report, we're going to provide more statistics and a breakdown of the license statuses. And that's where we're going to incorporate licenses and forfeiture status and the number that have been canceled within a specific time frame. As far as the discussion on the active versus inactive, I think we could probably keep that separate for its own standalone agenda item.
Correct, I agree. Okay, thank you. And if there's no other comments, I'd like to open this up again, just one last round for public comment for any other agenda items.
This is the moderator. We are now accepting comment on future agenda items. If you would like to make a comment, please type the word comment into the Q&A box in the lower right-hand corner of the screen and send that comment to all participants. Dial-in users, please dial *3 to raise your hand, and we will call on people in the order we have requests. Let us take just a few seconds now to see if we have a request for public comment. Seeing no request for public comment, do you wish to return to the agenda?
Yes, thank you. So at this time, before adjourning the meeting, are there any other comments from staff? Ms. Walker, Ms. Cruz?
No comments from staff.
None for me.
So are we at a good stopping point to adjourn the meeting?
Actually, Dr. Daniels, if I may, before we move beyond the future agenda items, another just suggestion, and it doesn't have to go at the next meeting, but just at a future meeting, is if the licensing committee has any interest in discussing a retired license status. We don't currently have that, but other programs within the department do offer that designation.
Yeah, thank you. Actually, I missed that. I would love to. I think that should be on the agenda as well.
It's been noted. Thank you.
Okay, thank you. Okay, it is now 1:20 and Monday, October 3rd, and so I'd like to adjourn the meeting.
Thank you.
Thank you.